everyone, and welcome to 368.tv. My name is Chooks, and I'll be your show host for today. With me in the house today is Peter Mellow, Director of Learning Design and Systems, Eastern Health. Hello, Peter.
Hi, thanks.
Good to have you on board. But before we begin, let's get to know you. Can you give us a little bit about your background and what excites you about the work you do?
Sure. 30 years in higher education as a lecturer.
Wow. Okay.
Yeah, so started off teaching in lecture theatres without any technology, without even an overhead projector. But I was really fascinated by how adults learn, so I moved out of my natural field of human anatomy and sports science into a central unit that supported a university. Came to Australia as a lecturer in the e-learning, and my last stint was at the University of Melbourne working on their MOOCs. I've been at Eastern Health for 7 years now.
I think that's quite an exciting journey, 30 years. And you've done some teaching. So I think my very first question, we're going to look at the health professionals because you work at Eastern Health. Very curious to know about how you've dealt with the challenges when it comes to hybrid and remote learning. Particularly, health science requires that people do it physically because that's where you get to know or get the right training. So how have you dealt with those challenges?
A great question. And of course, COVID challenged us with that. So, doctors have the old saying, see one, do one, teach one. And of course, you'd like to go with a doctor who's actually done more than one procedure. So we know that, training multiple times and training practically really important. Simulation's a big part of our business. So we have a dedicated simulation unit. But of course, COVID knocked all that on the head. We were told on a Friday that on Monday, we wouldn't be teaching face-to-face at all. So on the weekend, I rushed out to Bunnings, got some LED lights, went to JB Hi-Fi, got some webcam, and we set up self-service video recording studios. So that people who were teaching sessions on Monday could go in, do their presentation, and at least share that. We then got very agile and actually filmed procedures, not live procedures, but procedures on simulation. Okay. So how to sew up a wound care and things like that. And there were in COVID, there were a whole lot of new procedures coming out, like proning. So getting the person to lie on their stomach, because it's easier to breathe when they're having respiratory distress. Okay. But then of course you have to think about how do you do CPR on somebody when they're facing down rather than up. So we did a lot of simulation where we were filming those procedures, but we had to do something where it's real and it's tactile because the health professionals, whatever they were, nurses, doctors, physiotherapists, occupational therapists, whatever they were doing, they had to have their hands on. So we did do face-to-face training, but we had to do it in full PPE, which of course is very uncomfortable, but had to be done. Yeah. So I think we made the jump to hybrid and the remote learning. Yeah. People use their devices a lot, their own devices, which was great because there was a reluctance before that about using my own data. But I think we've moved on from that. Yeah. People just need to know they need to get the information, and if the easiest way to get it's on their cell phone, that works.
Just a very curious question. There were students who may have started learning in the remote format. How have they transitioned into this we're back to work kind of scenario?
We've got 11,000 staff and we've always got a churn of new staff coming in and other staff going. We also have 6,000 students from universities and polytechnics, TAFE schools around the Victorian area coming in doing placements. And of course, they've been taught a variety of modalities. Yeah. So I think, because traditionally a lot of us still had our school days in the back of our minds, they were okay with that. But not necessarily, the whole thing about the newer generation being more comfortable with technology, we didn't find that the case. I think the one thing that surprised me was the uptake of QR codes, which to me, before COVID, I would have said QR codes were dying out. But all of us, including the general population, realized that was a quick way to get to, a sign-in sheet or an informed consent form. So they really took off, and we're still using them. For example, we have QR codes on equipment. So if you're not sure how that equipment works, you can scan it with your phone and get a short video on how to use that equipment. Yeah. And that's been really helpful because it's that just-in-time learning and teaching that help people at the chalk face.
So it looks like the healthcare industry, I'm going to put that as an industry, was able to pivot especially when we're looking at education for health professionals. Now there's the aspect of the continuous learning and continuous development because things are fast coming in.
Yes.
So what are some if you can share your perspective of learning design strategies that have helped with continuous learning towards the professional development of your health staff?
we're in a constantly changing field, and you want the doctor who works on you or the nurse who works on you, to have the latest information and to use the latest procedures that are evidence-based, because you want the best results. So it's constantly changing, as you can imagine, as you know. Research papers are coming out all the time. During COVID, there were times we would be filming a new modality or new way of treating a person with COVID. The next day, something would come out would say it was better, so we have to refilm. But yeah, so as an organization, we're committed to lifelong learning. That was why I actually moved after 30 years in higher education into healthcare, because Eastern Health made a commitment to lifelong learning as defined by Peter Senge. So, and doctors and health professionals, all health professionals, they want to improve their care of the people they take care of. And so there's that ongoing desire, I think, to be better at all times. And I think our health staff are very good at self-reflection. And also at getting feedback from their colleagues. Well, I gave the example of one of our colleagues who's an anesthesiologist, and he has a QR code on his ID badge. And after he's done 8 or 9 operations, and the scrubs taking off their gear, he'll go around to the nurses and the doctors who were in the operation and say, scan that. And there's 3 open-ended questions. What did I do well? Feedback. What could I improve? And any general feedback. Because he said, I want to be a better doctor. We're trying to nurture that culture of being better, because, it's all about patient first, and it's all about good health outcomes for everybody.
Would you say that there's been, I understand that some people, like this doctor, is keen on getting better every day. Would you say it's the same for most? Or are people just doing it at their pace?
Look, I think with any population, it's a normal distribution curve. So you've got some early adopters like him. He's probably more of a lone ranger out in front of that. If you look at, the diffusion of innovation. So we've got early adopters. We've still got a lot in the middle, and we've got to cater for them. And the thing is, we've got to get behind the laggards and maybe challenge their thought processes. And there's ways around that. For example, a lot of people give us feedback on our compulsory courses and our LMS that, I know this stuff, you maybe sit through 5-10 minutes of clicking through. So what we're doing now is we're front loading the assessment. If you know this stuff, prove it to us. And if you do pass the assessment, you can go your way. But if you don't, maybe that's a challenge for you, that you need to think about the way you think, your knowledge, and you might need to go and recheck your knowledge by doing the course again.
Just piggybacking on the need to reset and keep checking on knowledge again. Can you discuss strategies for creating flexible and responsive learning pathways that accommodate the dynamic demands and advancements within the healthcare industry?
Yeah, well, I'm very lucky that I've got a really amazing team who work with me. Almost all of my team, I'd say 95% of them, are health professionals. So I've got a physiotherapist, I've got a ED nurse, I've got an ICU nurse, I've got a ward administrator, and having that institutional knowledge and having years of experience treating people, they first of all are used to the culture of Eastern Health, but also they know how it works. We can more easily identify what the learners need, what the health professionals need, and just give them, and we get this all the time, just tell me what I need to know. So we do the needs to know really, really concisely, really clearly, because we need to know that, and then we give optional learning. So there's if people want to deepen their knowledge, they can go and do that in their own time.
All right, just to wrap up, what are your key takeaways from your experience in the 30 years in education/healthcare profession that you want to share with anybody who's watching this and wants to learn from you, as well as your approach to work?
Learning is complex. Learning is messy. There's no easy answers. To try to condense it down into 3 points is challenging. I'm a big believer that learning has to be fun. I think it can be entertaining, but it is not entertainment. It is education. So I think it's really important. I'm passionate about, I think having people who are passionate about, and I'll go to any lecture, astrophysics, I don't understand it. But if the person's passionate about it, I'll listen, because their passion for imparting that information onto someone else, that passion is gold. And that's what I think. I work with passionate people. When a doctor gets up, and in medicine, there's so many different specialties. So, renal medicine, cardiovascular, neurology, and yet they are passionate about that subject. And so when they share it with their colleagues, when they share it at conferences, that passion comes out. I think that passion is the fire that keeps us going. And so be passionate about your subject, I suppose.
Yeah, I think that's a great way to end today's conversation. Thank you, Peter, for sharing your insight, your passion. I can tell you're very passionate about your work as well. So it's really good to have you on today. And thank you again.
Thanks for the opportunity to come and share.
You're welcome.